Very much, Mr Speaker. My question is to the Minister of Health. Does he stand by his health target to get genuine reductions in waiting times for elective surgery?
The Honourable Tony Ryall.
The premise of the member's question is incorrect. The health target for elective surgery is an increase in the volume of elective surgery.
Point of order, I beg your pardon.
I don't want to interrupt the Minister just as he's beginning his answer, but this...
Order, a point of orders. I say to the National Party backbench there, the noise coming out of that back corner of the House is unacceptable.
This question, as you know, Mr Speaker, has to be authenticated. So the premise of the question has been authenticated with your office. For the Minister to begin his answer by saying that the premise of the question is incorrect can't possibly be true.
Order. While questions are authenticated in terms of the face of the question, it doesn't necessarily mean that the question is not out of context or is not in a somewhat different context from what a minister's statement or target may have been placed. And so long as I don't want to hear the Minister criticising the member for asking the question, but arguing that maybe there's something that is out of context or the premise is not correct is not out of order. The Honourable Tony Ryall.
Mr Speaker, the premise of the member's question is incorrect. The health target for elective surgery is an increase in the volume of elective surgery by an average of 4,000 discharges per year. The government's concern is that sick people get their operations as soon as possible, and far more people are getting their operations now than under the previous government. This year, the government will deliver 140,000 elective operations, which will be 22,000 more patients a year than that member's government ever delivered.
Very good.
Grant Robertson.
Given that answer, Mr Speaker, is the Auditor-General wrong when she says that waiting times for elective surgery are between 9 months and 1 year, not the 6 months required by his target?
The Honourable Tony Ryall.
The member has to note that I haven't seen the Auditor-General's report, but what I can tell the member is that when we inherited this portfolio, there were a lot of people who were waiting more than 6 months to get their operation. And for example, 5 years ago, in January 2005, of the thousands of people who'd been promised treatment had not received it, 4.5% or over 1,348 patients had been waiting for more than 18 months. By January 2010, that figure had been dramatically reduced to 0.3% or 118 patients.
Order. Now the House is getting... I was critical of the National Party backbench. I say to the Labour Party front bench, the noise is pretty excessive today. But let me also come to the Minister. And the question was pretty simple. It asked a very simple question about the Auditor-General's statement. And the Minister used the opportunity to tell the House what he wanted to tell the House and not actually answer the question. And that's not really part of the game or the rules. But I let him get away with this occasion, but I'm just alerting him. Grant Robertson, supplementary question.
Thank you, Mr Speaker. Is the Auditor-General wrong when she says it appears DHBs are actually working towards providing a first specialist assessment within 12 months and treatment within 9 months instead of the 6 months required by the strategy?
Honourable Tony Ryall.
Mr Speaker, as I said earlier on, I haven't read the Auditor-General's report. What I do know is it's at the Ministry of Health. What I also know is I am never going to fix a waiting list problem by culling 30,000 people off the waiting list just because I want the numbers to look good like that member's party opposite did.
Dr Paul Hutchison.
Thank you, Mr Speaker. To the Minister of Health, what reports has he received about how the previous government handled elective surgery?
Oh, Mr Speaker,
Tony Ryall.
Well, I've received a number of reports that under the government, that government, elective surgery did not keep up with population growth, which meant patient access was cut. 5 years ago, the thousands of people who'd been promised treatment but had not received it, 4.5% or 1,348 patients had been waiting for more than 18 months. By January 2010, this figure has been dramatically reduced to 0.3% or 118. Look, there is more to be done, but this government is providing thousands more people with surgery, and we will not do what that party opposite did which was fix the problem by sending 30,000 people a letter saying we've culled you off the waiting list.
Grant Robertson.
Will he commit to releasing the Auditor-General's report as it now stands without him interfering or trying to doctor it?
The Honourable Tony Ryall.
Mr Speaker, I have got the report. The report is the property of the Auditor-General, and she will release the report once I'm sure she's had the numbers checked and precisely looked at by the Ministry of Health. But despite whatever may be in the Auditor-General's report, there are 400...
The Minister had answered the question absolutely adequately, and he's not going to go on to say despite and attack the questioner. Grant Robertson.
Will he allow the Auditor-General to investigate the credibility of his other targets, in particular the target on cancer treatment, given the cutting of cancer patients from waiting lists in the central North Island?
The Honourable Tony Ryall.
Mr Speaker, I would welcome the Auditor-General looking at the cancer radiation targets, and I'm sure she would find that, unlike the previous government, we haven't got lots of women's lives being disrupted by being sent to Australia for treatment. We are providing most treatment within 4 weeks, which is a world standard that failed party opposite could never match.
Question number 5, Jonathan Young.
Thank you, Mr Speaker.